Good evening to you all. I won't take much time, so we are having a responses talk. For those who don't know me, I am Dr. Safi. I work as a consultant at Apollo Hospitals, Hyderabad. I am not associated or I don't work for Amoul directly, but yes, I'll be definitely sharing my experience on the use of this device in our department. So basically, I'll be talking on the challenges of mechanical CPR, advantages of auto CPR, as well as application cases, few application cases with pictures across the world. So all of us know that there are various challenges what we face when we proceed with mechanical compressions, mechanical CPR during resuscitation. So the first important challenge is the duration of CPR is usually prolonged. We don't stop CPR after 5 minutes or 10 minutes. Usually we try for at least 30 minutes, or for some times in specific patients we do compressions for more than 1 hour also. So thereby the quality of compression will definitely get reduced and will not be able to perform adequate compressions for our patients. The CPR quality will definitely get reduced, and eventually the blood supply will get disrupted to the brain, and the success rates of resuscitations will not be appropriate. We have also seen that during performance of CPR in pre-hospital situation, like in ambulance or while transporting patients in the hospital, it's difficult because of space constraint as well as inavailability of performing appropriate compressions on the way while shifting the patient. So that's also one of the reasons why there is interruption of CPR and the quality of compressions will get reduced. So what are the advantages of auto CPR? So we have got the advantage that CPR, which is performed by Auto CPR device, has got high quality CPR and it can be performed for long duration. In addition to that, American Heart Association in 2015 guidelines has recommended the use of Auto CPR device so that the quality of compression can be improved. So for the doctor as well as the team will not be giving compressions once the patient is attached to the device. They can actually proceed with critical thinking of patients, to give appropriate medications, to proceed with defibrillation, and to provide effective ventilation. For the patient, yes, the compression rate as well as depth can be improved. In addition to that, this can even be performed in limited space as well as during transportation of patients. There is a good supply to the brain and eventually the success rates are high. So there are a few application cases wherein CPR devices have been used by various agencies, size between China and Vietnam. So it was identified that it was proven that high quality CPR was administered for long duration. Even it was not in the hospital setting, it was in a pre-hospital setting, it was in a situation wherein they didn't have appropriate facilities, medical facilities. Pamplona University from Colombia has recommended the use of Auto CPR device in Facebook, especially for monitoring as well as highlighting the monitoring of EtCO2 during compressions. So this was the hospital in Poland wherein they have trained everyone in use of Auto CPR device so that they can actually use it when patients land up into cardiac arrest in the hospital. So in the year 2022, this device was used to save a patient's life in Vedanta Hospital in India, in Uttar Pradesh. And E6 device of Amoul was used to save more than 50 patients' lives in India, in Apollo Hospital, in CMC Hospital, as well as other hospitals. So these were the few images from patients in Thailand. Images from patients in China. So what is the device? There are two devices by Amoul. The first device is an E6 device. It works in sync with Amoul transport ventilator. So whenever we put the devices in sync, after every 30 compressions, whatever rate as well as depth of compression is what we have set, after 30 compressions or 15 compressions, it provides 2 ventilations. So the manpower is actually reduced. The requirement of manpower is reduced once we put the patient on this device. It has got a higher duration. It works on batteries. So it has got 2 batteries. It provides a duration of uninterrupted CPR or compressions for 90 minutes. It has got EtCO2 monitoring also available along with it. It has got 3 modes 15:2, 30:2, as well as continuous compressions for patients who are on advanced airway. It has got a touch screen panel which shows multiple things. We are able to set the depth as well as the rate of compressions, as well as we are able to actually see the log of the compressions. So the steps are very simple. There are 4 steps of application. There is a back panel which has to be kept below the patient's chest, and on the top we will be connecting the device. The legs of the device will be connected onto the back panel, and there is a stabilization band which will be attached to the patient, and the switch on button is to be pressed. The device is very handy. It can be carried anywhere in pre-hospital setting, in the ambulance or other locations. The other device is CPR E3 device, which is a unique model which has got inbuilt CPR as well as ventilator function. This device has got 3D compression mode, which improves the CPR efficacy and causes less compression injuries. It has got 5 modes: CPR, ventilation, and depth of compressions can be adjusted appropriately. It again has got an interface which shows the ETCO2 monitoring as well as other functions. So this device has got 3 steps how we can use it off. The first step is powering it on. The second step is application. The third step is to press it start for starting the compressions. So these are the images what we have taken for during resuscitation of our patients, and we have seen the results in our hospital. To summarize my talk, I'd like to present a short video. Well, that was about the device. There is a stall which has been set up outside. So after the session, you can visit the stall. Mr. Harinath will be available, and he will be showing you the operation of this device. Thank you so much.